Hello, my name is Troy, and the treatment topic I chose to do my presentation on is cognitive behavioral therapy. I tried my best to get the best information I could and try to fit it all in this brief 5-minute presentation. So I hope you enjoy. So, what is cognitive behavioral therapy? It is a form of psychological treatment that involves trying to change a person's thinking and behavior patterns. So it's pretty much trying to get people to change their negative thoughts, feelings, and behaviors that they may have towards something and redirect it into a more positive way of thinking. Some of the main goals include changing distorted thinking patterns, to gain a better understanding of motivations behind certain behaviors, to teach people problem-solving skills to help them better cope with situations they may face in life, and to help them gain a better sense of self-confidence in the things they do. So the effectiveness, I found that cognitive behavioral therapy is effective at treating a wide range of problems. Some of these include mood disorders, substance use, marital problems, eating disorders, and other forms of mental illnesses or other forms of addiction. As I mentioned before, it has been shown to be very effective, and some studies shown it to be effective as, or if not more effective than, other forms of therapies that are out there and different types of medications used to treat different problems. So a study I found was from a group of Chinese researchers looking at internet addiction in adolescents. These adolescents were about the age of 12 to 17 years old. So he used 56 participants. The treatment group had about 32 and the control group had 24. And for the treatment group, they received 8 sessions of school-based group cognitive behavioral therapy. So what that means is that they were in like a school setting, like in like a classroom area where they would talk about different subjects such as like impulse control, content you may find on the internet, recognizing addictive behaviors, different ways of treating addictive behaviors, and so on. So each session was about an hour and a half to 2 hours long, and the control group received no type of intervention. And what they found was the internet use decreased in both groups. The treatment group shown improved time management skills, emotional behavioral and cognition improvements, so like overall better happiness, thinking, and behaviors. And they shown an improved ability to better regulate the things they do, such as like the time they spend on the internet, time they spend doing different activities, and so on. And what they did was they had all the participants take different types of questionnaires and rating scales before, after, and then they did a 6-month follow-up after the experiment was over. And these questionnaires had questions such as like how much time do you spend on the internet, relationships to peers, parents, your happiness, like different activities you do, and things along those lines. And there were not much mentioned about the control group in this study. So in conclusion, cognitive behavioral therapy is a type of therapy that, with the goal of changing people's way of thinking, so it focuses on changing the negative thoughts and feelings someone has towards something and redirecting it towards something positive. It's effective, if not more effective, than other types of therapies and medications you may find. And what I also found is that it's actually pretty short and simple to use. When I looked it up, I found like different ranges of like treatments people use. But the most consistent range I found was that it takes about 10 to 25 sessions to pretty much prove effective if that makes sense. And I think that is my time. So I hope you guys enjoyed and learned something new. Again, it was hard to take all the information I found and try to pick out what's best for a brief 5-minute presentation. So again, I hope you enjoyed and thank you for watching.